So you have seasonal allergies. Not managing seasonal allergies can lead to an increased risk of respiratory infections. While early manifestations of allergies are not tied directly to bacteria or viruses, but rather your body's own built-in defense systems overreacting to things in your environment. They can foster an environment that may promote the growth of viruses and bacteria, leading to an upper respiratory infection. Have you ever heard the age-old adage, don't drink from still waters? If you're out camping and need emergency water, it's generally known that still water grows bacteria and allows other parasites to colonize the water source. Your body isn't any different. Our ears and sinuses naturally make small amounts of various types of fluids. This is natural and not inherently concerning. Where it does become a concern is when the drainage routes plug up and bacteria and viruses may begin to grow, leading to infections. Your sinuses both drain into the middle meatus of the nasal cavity. Thus, a plugging up of your nose can lead to fluid buildup and pressure in your nose and your sinus cavities. Often this buildup is perceived and described by patients as a sinus infection due to feeling large amounts of pressure and pain in their sinuses, along with the accompanying headaches. Histories that can point towards allergies. If you find yourself saying, this occurs every year at the change of the season. Another common trend for environmental or seasonal allergies is the condition arose following recent travel. Think about it this way. Your great-great-great-great-grandfather, the farthest he ever traveled in his entire life was likely what? 30, 40, 50 miles? Nowadays, we'll hop on a plane and jump from Tennessee to Greece and back in a week and wonder why our bodies are freaking out. So, it's allergies. What do we do? Primary treatment involves avoiding the allergens. Good luck with that. They're everywhere. Antihistamines, such as Claritin, Zyrtec, or Allegra, and intranasal corticosteroids like Flonase or Nasonex. My general approach to itchy, scratchy throats and nasal congestion is for the first 24 to 48 hours, assume it's allergies and manage it as such. I personally use a daily Flonase, but if that's not fully controlling my nasal symptoms, I add an antihistamine to my self-care. If headaches arise, take a Tylenol. From there, I advise playing it by ear. If when the medication is beginning to wear off, you feel the symptoms worsening, take it for another day. Failing to improve while trying these interventions considerably shifts my index of suspicion to viral or bacterial etiology. So, you're responding well to the allergy treatment, but don't want to stay on allergy medication forever. What can you do? This is where supportive and complementary therapies come into play, such as avoiding the allergens via things like HEPA filters and living spaces. Ensure you have an adequate amount of filtration in the space you are attempting to cover, and remember to follow the changing the air filters at appropriate intervals. Locally sourced honey is a hotly debated subject for the treatment of allergies. It may provide relief and is a relatively low-risk intervention that would best be used as a complementary form of treatment in addition to traditional medical management.
But I feel terrible in the past. My doctor gave me a steroid to help clear this up. Why can't we do that today?
In the past, we played fast and loose with steroids and antibiotics to treat things that may be URIs or may be allergies. Both of these medications have significant drawbacks. While it is true a steroid will make you feel better almost immediately, the drawbacks are significant. Simply put, steroids work by telling Osmosis Jones to calm down, everything's fine. It suppresses your body's natural immune, which decreases mucus production and reduces inflammation. The result is a rapid decrease in symptoms. However, this immune suppression increases the risk that a bacterial or viral infection is allowed to take hold. In addition to the increased risk of a follow-on infection arising, steroids also raise your blood sugar, blood pressure, and repeated use can cause long-standing issues such as osteoporosis, Cushing's syndrome, and adrenal insufficiency. All of these known complications related to steroid use means your provider should use caution when deciding to utilize this medication. While it is effective at making you feel better, in this particular case, it is merely masking the symptoms, not treating them. Don't get me wrong, there are conditions and ailments where steroid usage is appropriate. This is not one of them.
But what about an antibiotic? Would that make me feel better? My old doctor used to give me is a Z-Pack every time this came up.
A Z-Pak or azithromycin is an antibiotic that has commonly been used in the past to treat upper respiratory infections. However, it is not appropriate for treating allergy-related symptoms. In addition to being inappropriate for treating allergies, the overwhelming majority of upper respiratory infections are viral in nature, and therefore no antibiotics are actually effective. Overuse of antibiotics carries a wide risk of problems. It's estimated around 10 to 20% of people who take antibiotics experience a negative side effects such as nausea, diarrhea, and potentially more severe reactions such as allergic reactions. From the provider's perspective, overuse also contributes to the growth and development of antibiotic-resistant strains of bacteria.
I really don't think this is allergy juice. What can we do for upper respiratory infection?
Seeing as this video's already went on for 5 minutes, see the follow-on to explain our thought processes with upper respiratory infections.